My name is Phoya. I used to work for the Ministry of Health up to 2013 and I retired. Currently, I'm still working in the ministry part-time for a Scottish funded project with the University of Aberdeen, which is looking at how to make the new group of community midwives integrated within the government system public health. Yes.
And within that project, what have been the major priorities or issues that you've been trying to address?
This project, like I said, is looking at community midwives. The main issue that we are looking at is the high maternal mortality and neonatal mortality in Malawi. So the project has been trying to see how best can we improve access to maternal health, especially for the rural poor, and also how we can build the skills of both the teaching staff that are teaching nurse midwives, but also the practicing midwives, how they can support the newly qualified midwives. That's what we are doing.
Thank you. There's obviously been a strong relationship between yourselves and the University of Aberdeen. As you look forward to the future and advancing maternal health issues around midwifery, etc., how do you feel that the Scottish contribution can be developed?
I think it can be developed further because issues of maternal health are still a big issue as a health priority in Malawi. And University of Aberdeen has been a long-time partner for the ministry, but also for me personally, because we started working some time back, like early 2000, when we had a safe project that tried to define what does it mean for a woman to have a skilled attendance at birth. Now we are looking at the specifics on what can we do to improve the skills of midwives. And I think there's a lot of room for University of Aberdeen and Malawi to continue working on this because Malawi's maternal mortality is quite high. We have not yet reached our MDG. So we are hoping that now we are moving from MDG to SDGs. Issues of mothers and children will still be high on our agenda, and the university is so interested to partner with Malawi in these issues.
Thank you. We're all aware that there has been terrible flooding in Malawi over the last few days and over the last past week. What do you anticipate will be the major, particularly health challenges related to the flooding?
In fact, I feel guilty that I'm here this week when there's flooding in Malawi because personally my village is affected. People have lost their houses, food, and all that. So the major challenges that we are seeing, first of all, is that these people have no shelter. They're sleeping in the rain. Plenty of water brings in issues of like diarrhea, other communicable diseases, mosquitoes, malaria. So there is a big challenge, both health-wise and nutrition-wise. Yeah.
And how do you think some of those challenges and issues that are going to be raised could be addressed over the coming weeks and months?
Before we left Malawi, I think government had organized a center where efforts of both government, well-wishers are coordinated to make sure that people can provide either money or other things in kind like food, blankets, which are distributed to the affected communities. The other thing that has also happened, which is worrisome, is that now schools that have not fallen down but are closed, children are not going to school because the schools now have become a refugee center, something like that. So education-wise, children have also lost out on their learning issues.
Yeah. And just finally, is there any contributions people in Scotland could make to those efforts in responding to the flooding?
Yeah, like I've said that there's need for shelter, there's need for food, there's need for blankets. So if the Scottish people can work through their partnerships that are already existing in Malawi, because like I said, the NGOs, both government are working together. So if we can send, whatever we have through the already existing partnership, I think that would be the best way to go.